Hi everyone, I am Dr. Jacopo Gallotti, plastic surgeon from Napoli, Italy, and today I'm going to talk about the use of Doublyx EVO for facial rejuvenation and restoration. I'm going to use it on this beautiful patient today, which is quite young and still a bit suffering of skin laxity and a bit of loss of volume in the middle third. As you all know, Doublyx EVO is hyaluronic acid, low molecular weight, not cross-linked. And we all know that low molecular weight hyaluronic acid promotes fibroblast migration and keratinocyte migration as well. So we're gonna have improved of the skin quality, skin laxity, and of course the enhancement of the collagen production and extracellular matrix. My personal approach on facial rejuvenation, especially with low molecular weight hyaluronic acid, is throughout the use of micro-cannulas. So I only use one entry point, and from this entry point, I can treat the whole face. I go definitely subdermal, because the dermis cannot be entered through cannula, but throughout this treatment, we are able to involve both superficial layers and deeper layers, and especially ligaments, which are also put into tension, and the face, even without adding volume, will increase in skin tone and a sort of tightening like this. She's also suffering of a bit volume loss here. In part, this volume loss will be replaced by the fibroblast stimulation, or afterwards, after 2 or 3 treatments with Doublyx EVO, we can even add some filler. The treatment will be carried out from one entry point. You can choose wherever you feel comfortable with. I usually use midpoint in the mid face so that I can treat all the area without exiting with the cannula. This is my entry point, and from here I'm gonna go fanning throughout the whole face. From this one entry point with a 25 gauge cannula, we are able to address the whole face. The treatment is basically without pain. I go anyways superficial with the cannula, and I can even reach the tear trough, that it's quite an easy area to address with the cannula, but it's also difficult with hyaluronic acid. But in this case, I'm safe, because even if I'm superficial, I know that this product is not meant to stay, but to stimulate, and the tear trough is going to improve a lot. Then I can go through the nasolabial fold in a sort of fanning way, perpendicular. And even if I'm not feeling, by the end of the treatment, you can see that the face is already a bit lifted. I can even reach all the way down to the marionette line. And with a bit of anesthesia, the patient is not standing any sort of pain. I can go all the way down to the mandibular line, using half of the vial for the half face. So again, as you can see, I am treating the mid-third all the way to the tear trough. That it's going to improve thanks to the stimulation and not the filling. And I am also improving the tone of the skin septa and the skin ligaments. And at the same time, I am improving skin quality. So I am addressing this way several different layers. Doublyx EVO can be used to stimulate other areas of interest besides the face. So we can improve the skin quality and the toning of the neck, and also, if needed, the hands. Again, the personal technique is carried out throughout cannula rather than dots, because it can be useful to stimulate both skin that's on the neck is extremely thin, but also probably we can improve the tone of the platysma that causes the bands and also the venous colors. So, in order to have our patient comfortable, I inject a little anesthesia on my entry point. The entry point is the only area that actually suffers of the entrance of the cannula. Throughout one entry point or two, the product is spread all over the neck and its skin. The layer is between platysma and the skin. So I want to be superficial. I want to see the cannula, the tip of the cannula, and I stay tangential to the skin. And of course, I don't want to go deep. So I just release the product into a retrograde fashion. So I go in and out this way. It doesn't matter if you can see some little hump at the beginning, because they will go away in 48 hours. The product itself is very safe, so you're 100% sure there will be no visible product onto the neck, which has a very thin skin, as we said, and the product will not interfere with any treatment such as radio frequencies, needles, needling, or anything else. It's again, the treatment is basically painless and can be carried out through just one entry point or two. In this case, I choose two because there are some colors here. By the end of the injection, you can either massage or not. The massage will spread the product a little bit better, and of course is going to reward the patient after the treatment itself. After the treatment, I usually massage the neck and I ask the patient to do it back home for a few days. The massage is carried out in an upward fashion from the inner part of the neck to the outer part of the neck for a minute or so. And then inward, outward also in a upward fashion like this. The massage is going to stimulate the product and also spread it heavenly and better. Doublyx EVO can be used also in the improvement of skin of the hands, which is again a very, very, very thin layer. The injection is very, very superficial. As you can see, when I release the boluses, you can see them on the skin, but that has no matter of problem because the problem would be absorbed. You must be very careful because there are veins all over. So the cannula in this case helps us to avoid hematomas or bruising if you're being, of course, careful and delicate. Throughout the cannula, we can inject the hand, the whole hand, with just one entry point or two, it depends, and we can reach also the distal part of the hand. Even on the ends, it's very important to spread the product, but not because it's going to cause lumps or humps, but just because I want to spread it evenly all over the surface. What you can see already with just one injection is that the skin gets hydrated quite immediately, if you can see it from the treated side to the contralateral hand. So as you can see, now we are at the end of the treatment. The treatment is over and there is no visible sign, but the entry point of the cannula that is going to fade and go away within 24 hours. Sometimes there is a little bruising, but considering how delicate the skin of the neck or the hands are, this is very, very limited. In terms of protocol, my opinion, and of course scientific articles, they display that the use of hyaluronic acid should be carried out between 3 and 4 weeks apart. So the patient is going to be scheduled for another treatment within a month or less for 2 or 3 treatments in a row. And then she will carry out for keeping the improvement of the skin once a year or twice a year.